What is up, everybody? It's Mike and Eddie and Mike, the dynamic duo, as many have called us. Maybe they will call us after this video. Anyways, today we are looking at Eddie's knees, particularly the right one. We're going to show a little bit of love to the left one as well. Just give you a little bit of history on Eddie here. Eddie played football from what age?
12 to 18, yeah.
Yeah, so young age, all the way into high school, and then you started a little bit of college.
Mm-hmm.
Perfect. So, as you can imagine, his body has seen the rough of it. Today we're going to be treating the knees. In videos in the past, we've treated the shoulder. So you guys probably already heard a little bit of history about that. But today we're looking particularly at what we're going to be calling patellar tendinitis. Patellar being the knee itself, and there's also a little bit of ligament sprain strain history as well. To add to the backstory, sometime in 8th grade during practice, Eddie was doing a move that involved not only explosively standing up, but also a little bit of a fast turning motion. The ACL loves those motions, as everybody knows. So never had MRIs, so I don't want to end up saying, ACL, MCL, LCL. I don't want to try to diagnose it, but what we do know is from that moment onwards, Eddie always experienced a little bit of pain. He was talking to me prior to the video, and he kind of explained that movement helps, but if he kind of goes about 2 weeks of being stagnant, he'll really start to feel when that knee gets loaded. So again, we're kind of from that can narrow down that there is some sort of ligament sprain and strain history there. Now, as we know from our videos in the past, our good friend, the Focus Shockwave, is awesome at any sort of ligament tendinopathy, particularly in the knees, as we've seen. So this is going to be, unfortunately, a unpleasant experience for Eddie, but a fun video to watch for the viewers. Let's go ahead and get started. So primarily, most of what we've got going on is in the lateral side. And again, we're going to be treating both of the knees, but the right one is a little bit worse than the left. So we'll go ahead and get things started. Eddie, I'm going to start it off pretty light. I don't imagine we're going to get too terribly high once we start finding the good spot, but just let me know as we want to turn it down, okay?
Copy that.
All right, so pretty light so far, right?
Pretty light, yep.
Perfect. Let's try right here, but we'll start to try to explore for the good areas. So somewhere in this region.
We're finding something in there. Yep, there we go. Yep, now we're working.
And let me just make sure. Yeah, that's kind of right where you told me it is too. Now, how are we on our pressure there? Do you want me to turn it down, or is this?
We can turn it up, actually.
Turn it up a little higher.
Yeah.
Eddie's trying to impress the viewers now.
Ooh, there we go.
All right, there's the fun faces. Okay, so worse than where we just were?
Yeah.
This spot's not the best either, though?
Yep, there we go.
Okay.
Yep, that's the worst one.
Gotcha. All right, and like you guys know, we're just kind of finding those trigger points. We're going to spend some good time in each one. I'm just sort of plotting out the area right now and just really figuring out where everything is. So again, the Shockwave is always a little bit of a back and forth between patient and the CA or the doctor that's administering the treatment. It definitely helps with the verbal cues like that, the non-verbal cues rather, but the verbal cues help us out as well, just when we're really trying to, search for the spots or compare what's worse. This is definitely the worst spot though, huh? A little bit worse than where we just were.
Having the time of my life.
Yeah, I told you guys this would be a fun video. So what would you say, Eddie, now that you've gotten the knee, or you're currently getting the knee, you've gotten the shoulder several times, what area is more fun?
The knee's definitely more spicy.
I imagine so, yeah. Now again, this video is, I don't want to be a deterrent to anybody. Eddie is fighting it a little bit more than you need to. We tell patients ideally you're looking at it for a 3 or a 4 out of 10. Eddie's probably sitting at a 5 or a 6, but you know football guys, they like pain, so we're giving Eddie some tender love and care right now.
Yeah. Whew.
Okay, so not as bad down there, but
Yeah.
a little bit spicy. Yeah, I know this region gets bad, but I'm just trying to see. How about the patella itself?
Oh yeah.
Not too bad?
Not too bad, but
Okay.
we do feel it. Ooh, yep.
You want me to turn it down?
Just a bit there. Yep, doable.
Got a little bit of inflammation up on the front of that patella there, and that's what I was kind of palpating. That's what I was palpating there at the,
Oh yeah.
the start.
Mm-hmm.
You want me to turn it down again, or?
Nope. We're good.
All right, perfect. So what the Shockwave is doing, for those of you who haven't heard the explanation, we are currently breaking down cells in the targeted area or wherever this handpiece is touching. The focus Shockwave, you have to imagine the energy output is more of that of like a sniper rifle, so it has to be very precise. Our radial Shockwave, on the other hand, we'll give Eddie just a little bit more so I can finish this little excerpt. Our radial Shockwave, on the other hand, is a little bit more wide in the energy output. So that's, again, why this one relies a little bit more on that back and forth, is because it needs to be so precise. It's such a small diameter, if you will. Now, what we're doing, though, back to what I was saying, is we are killing off the cells of the targeted area, and what's that's doing is our body's going to treat it as a trauma response. So we're going to pump in fresh blood, fresh oxygen, and as a result of that trauma, the body's actually going to bring in fresh stem cells as well. So you're going to get the stem cells kind of coming in and not only rebuilding the cells faster, but they're actually going to be a little bit stronger that second time around, because when your body's exposed to trauma, it doesn't want to have to keep rebuilding itself over and over again. Now, that being said, let's go ahead and flip Eddie over. I'm going to just get him cleaned up real fast, and we will check out the other knee. So Eddie, if you wouldn't mind, go ahead and pop up for us. I'll take this, switch that,
Thank you.
and
Thank
there
you.
we go. Alright, so still dealing with the lateral side of the knee?
I believe it's mostly in the patellar tendon, actually.
Okay,
But
gotcha. And for those of you who don't know, lateral is right here outside. Medial would be the inside of the knee. Just in case you're hearing terminology that you're not quite sure of what we're referring to. Now, Eddie, I'm going to turn it down a little bit just because we're going to start right on the patella.
Thank you.
Just like you saw, is a little bit of a spicy area.
Yeah.
So just let me know. I'm going to give you a little bit more here. Let me know as we start to build it up when we get to that point that you feel is comfortable, or
Gotcha.
at least tolerable, rather.
Gotcha.
I don't think any level is comfortable. Bad word choiceage.
Ooh, that's good.
Okay, perfect. Alright, so let's play with the angle a little bit. I don't want to go too high up on it, but right there's... Okay.
Yeah.
You can definitely tell by the face. So if we rotate around, does it get a little bit worse there? Or not too bad?
Not too bad.
Okay. And I'm feeling for where the bone, well, more bonier structures are. We don't want to stay on top of those. So we're really just flared up kind of right there.
Yeah.
We're going to turn it up just a hair here too.
Yep.
Now again, we're not going to get as bad of reactions from this side, especially after he hits that like 30-40 seconds and really starts to kind of disassociate with the pain, if you will. But This was, again, our little bit better of a knee. Right there. Not quite.
A little bit twist. There we go. That's it.
There it is.
Yep.
So another really good modality that we can use to treat the knees would also be dry needling. The benefit to Shockwave, the benefit to dry needling, is it really lets us get into these deep structures, such as the patella, such as, hamstring, such as the low back. Really the structures that we aren't able to really physically, oh, we've got a spot there, everybody.
Yeah.
The structures that we aren't, you want me to turn it down, Eddie?
No, we're good. We can fight this.
All right.
I can fight this.
The structures that are a little bit deeper, a little harder to get our hands working into, those modalities will really benefit you a little bit more than that hands-on, soft tissue work that our doctors have done in our videos in the past. All right, Eddie, you hit the safety number. I said that would be pretty good there.
Okay.
All right, so we just finished up with Eddie's Shockwave. We've got them all cleaned up. You guys saw the fun facial expressions. If you want to come down to my house of pain, just kidding. If you want to come into Kalkstein Chiropractic and get any sort of tendinopathy treated, or even just have a little round of the Focus Shockwave, come on in. You can ask Eddie.
I highly recommend it.
We'll see you next time, everybody.